Okay. Good morning. So could you tell me who you are and what role you play at Medway Maritime Hospital?
Good morning. My name is Dr. Victor Anota. I'm one of the consultants in A&E. My primary job as a clinician is obviously to look after patients. But besides that, I have other non-clinical commitments. I have to say, it's really an honor being the BAME chair for the network, something that I took up back in May this year. So it's been a wonderful experience for me. And like I said earlier on, it's an honor for me to be able to lead the network. As part of my job as a consultant, also, we have medical students, from King's College, that we look after them, supervise, make sure that they are on track for their training. We also have junior doctors who are rotations GP trainees that we look after. So that will pretty much cover most of the things that we do from day to day. Yeah.
And how long have you been here?
I started off with the trust back in July 2018. I have to say that when I joined there initially, it was on a temporary basis, just for me to see how I settled in the environment. But it didn't take me long for me to to have that conviction that this is the place I wanted to be. And by February 2019, so I signed the substantive contract. So I've been here for 2 years now, sort of.
Okay. And where are you from, and what is your cultural heritage?
I'm originally from Nigeria. I would say I'm from the Yoruba-speaking part of Nigeria, which is from the southwestern part of Nigeria. People will be surprised that we have over 250 ethnic diversities in Nigeria. But the Yoruba, the Yorubas are one of the major ethnic tribe in Nigeria, and what we do is we've got a very rich culture. That dates back to several years back. In terms of what people do, traditions. People still celebrate them up to today. If you go there, you hear people talking of some Egungun festival, which is like some kind of masquerade that people mark from year to year. We have people have their religion as well. We have Muslims, we have Christians in Nigeria, and then we have also the people that belong to other the long age traditions of probably just staying with their own belief. They are not Muslims, they are not Christians, but they have their own religious belief. So that's what I would describe as my cultural heritage, sort of.
Mm. And then what brought you to Medway?
Like I said, I have been in and out around the Medway for longer than 2 years, because I've known most of the people that work in the A&E department there. Most of the consultants there, they are my colleagues. I've known them for years, and I have to say that even before I joined in 2018, I used to come and do all the locum ad hoc work during my rotations, and from there I kind of fell in love with the people. Yeah, I found them to be quite hardworking. The staff are quite dedicated, quite committed. Despite working with difficult challenges, limited resources, but what I see day in, day out, people willing to give their best, always wanting to reach far beyond what the ordinary. So that was the main thing that attracted me. That this is the people that I want to gel with. I want to come and contribute and add my own quota. Building the community. Yeah.
Mm. But if there was one thing you could change about the hospital, what would that be?
said that, okay, I love the way the staff work. I would love to see a community that is more, the culture that is more open. It seems that, okay, we still live in this pocket where we see ourselves as I'm from Africa, or I'm black, I'm white, I'm Bangladesh, I'm Indian. I want to see a culture whereby people see us as one big community, whereby we've taken down the walls of partitions. Based mainly on what people have come from or the color. So that is what I want to see. I want people. I would love to see people being open. Being honest. Be willing to tolerate. Get to know what is in the other people's culture. So that is what that's what I would want to see as my number one priority or dream.
And thinking of your career as a whole, what has been the biggest challenge that you faced?
Biggest challenge was obviously, during the rotations, we take a lot of exams. It can be quite difficult. Juggling between exams, night shift, family commitment, long commute. So the exam was the one I found to be quite a challenge, especially my exit exams. I found it quite challenging. Like I said earlier on, it was mainly because of so many competing factors. Families, long commute, night shift. It was. I found it quite challenging then to be able to manage all these demands.
Yeah. And then if you could go back in time and give one piece of advice to your younger self, what would that be?
It would be that, okay, be yourself, remain focused, keep working hard, be loving, and love people, love your community. There will be challenges, but don't give up. There is light at the end of the tunnel. So that would be one main key thing that I want to probably give to myself looking back, because you will face challenges and then you feel like you're giving up, but that is not an option at all. So keep believing, keep working hard, love people, love your community, give your best, and then the best will come to you.
Yeah. Thank you very much.
Thank you.